Hey guys, Dr. Jeff Feenstra here with Pro Chiropractic, and wanted to shoot a really quick video to show another one of the therapies that we often use as an adjunct to some of the treatment that we do. I wanted to show something for shoulder problems. This can be used for a wide variety of shoulder problems. It can also be used just basically shoulder recovery, after a tough workout, anything like that. And so what it is compression banding or flossing. Some people call it Voodoo Floss. There's a couple different names for it, but I'm going to show you how it works, why we use it. Like I said, a lot of times I'll use it as an adjunct to adjustment therapies, to other different soft tissue therapies as kind of part of the functional rehab that we a lot of times will do here in the office. So I have Andrea here, and what we're going to do is I'm going to show you kind of just a little quick demonstration on how I apply this. Okay, so what I'm going to have her do, she's going to put her arm all the way out, and then this floss is just like a really, really stiff rubber band. And so she's going to lock her shoulder. A lot of times I'll kind of put it into a position where it's not painful. So a lot of times with shoulder injury, we get that impingement where internal rotation and adduction or cross-body flexion will create some pinching and irritation. So I'll put it typically at about a 45-degree angle and then get her into a little bit of external rotation. And then from there, I'm going to start kind of right about the top of the AC joint, and then we're going to wrap the shoulder. You can do this right over clothes. It's actually a little bit more comfortable. Try not to punch her in the face. And then I'm just going to kind of tighten it up with each wrap. And then as I go, I'm just going to check in with her. I'm not cutting off your circulation too bad, am I?
No.
It's going to cut some circulation. You're going to get a little bit of kind of tinglies in the hands a little bit with this. And so I'm going to wrap it. See, I kind of get a little tighter with each one. Catch that whole shoulder. And then I get it here, and then I'm just going to kind of tuck it. And that's just to kind of hold it in. Try not to pinch anything. Okay, so now from there what we can do is we can do a lot of different things. We can have her simply just come to here, and we'll do an external rotation. We'll do an internal rotation, just kind of checking in with pain, making sure we're not getting any pinching. A lot of times that impingement that we get, as soon as we apply this really good compression to that shoulder joint, the impingement symptom goes away. So I can internally rotate, I can pull it across, and oftentimes there's zero pain with it. So this compression banding does a couple of different things. It's going to really compress all the tissues, and it really squeezes out if there's any pain, if there's any inflammatory exudates in the tissue that's creating some of that pain. It squeegees everything out, kind of compresses it out. And then as soon as we pop it off, what happens is the body's going to naturally reperfuse that tissue. It's going to push blood into that area. Creates a really good healing response. So typically I leave this on a couple of minutes. Like I said, we can do lots of different rehab things, mostly just kind of range of motion. You can add some resistance, different things like that. And then I pop it off. And like I said, as I pop that off, the body's going to reperfuse, and it's going to push a bunch of good blood flow into that tissue, stimulates a really good healing response. So again, Dr. Jeff Feenstra with Pro Chiropractic, another one of the really good therapies that we use here in the office. Check out our YouTube page. There's tons of other good stuff on there. Go to our website too. Have a great day.